Hi, my dear. This is Dr. Jocelyn, a urologist for over 15 years. And today, I'm going to show you a simple 2-minute trick before bed that can completely change your night and your next day. If you wake up several times to urinate, if the stream is weak, if you feel like your bladder never completely empties, you are not alone. I see this every day in my practice. Strong, hardworking men who start to suffer in silence, thinking it's normal, that it's part of aging. But let me tell you something. Getting older doesn't mean suffering. And what worries me the most is not the enlarged prostate itself. It's what most people do, thinking they are helping, but actually making everything worse. Look, I know how it is. You're lying in bed, finally resting after a tiring day at work, and suddenly that urgent need to go to the bathroom comes. You wake up, go there, do a little, go back to bed, an hour later, again and again. And when you finally fall into a real sleep, it's almost time to wake up. The next day, you are exhausted, irritable, without energy. And worse, you start to avoid drinking water at night, stop going out with friends, become afraid of traveling, of getting stuck in traffic. Your life starts to revolve around the prostate. You don't need to be ashamed of this. Millions of Brazilians go through this after 50. In fact, studies show that more than 50% of men over 60 have symptoms of enlarged prostate. So if you are going through this, you are in good company. But the question is, you don't have to accept this as your fate. Let's solve this together, simply and cheaply. Now let me explain the signs your body is giving. Pay attention if you identify with any of these. Waking up 2, 3, 4 times or more during the night to urinate. That feeling that the bladder never completely empties, even after urinating. The stream that starts weak, stops in the middle, or takes a long time to start. That sudden urgency, as if you can't hold it for even another minute. These are the classic signs. And ignoring these signs doesn't make them go away, my dear. In fact, it worsens the inflammation, drains your energy, affects your mood, your willingness to live. But why does it get so much worse at night? That's a question I get a lot in my office. During the day, you are active, moving, distracted with work, with tasks. But at night, when the body should relax, entering that deep rest mode, in many men, the exact opposite happens. It's like a pipe that is already tight and is still receiving more pressure. The nervous system remains accelerated, the prostate becomes sensitive, and the surrounding muscles stay tense. And the result is more trips to the bathroom, less sleep, more fatigue. And here's something that almost no one explains, but it makes all the difference. The biggest mistake is thinking that this is just a matter of age. I had a 62-year-old patient who thought it was completely normal to wake up 4 times every night. He said, "Doctor, it's age, right? My father was like that too." And I told him, "No, my dear, it's not normal. It may be common, but it's not normal. And it doesn't have to be this way." After a few simple changes in his routine, he started sleeping through the night again. Imagine the difference that made in this man's life. His energy returned, his good humor returned, his desire to do things returned. Now, let me explain to you what is really happening inside your body, because when you understand the problem, it becomes much easier to solve. The prostate is a small gland, roughly the size of a walnut, located just below the bladder, and it surrounds the urethra, which is the channel through which urine passes. Think of it this way. It's like a ring around a pipe. When that ring is healthy, thin, and relaxed, urine flows easily. But when the prostate enlarges, becomes inflamed, or tightens, that ring constricts the pipe. Then, urination becomes difficult. The stream weakens, you have to strain, the bladder doesn't empty properly, and the urge to urinate returns quickly. But here's the detail that many people don't know. It's not just the size of the prostate that matters. Of course, size can be a factor, but what really complicates life for most men is the tension and inflammation. And the tension comes from a place that few imagine, the nervous system. Let me explain this to you in a simple way. Our body has 2 main modes of operation. There is the action mode, which is when you are working, solving problems, dealing with the stress of everyday life. And there is the rest mode, which is when the body relaxes, digests, recovers, and regenerates. The problem is that many men live in action mode all day long, 24 hours a day. The body doesn't know when to turn off. And when you are in this constant state of alertness, the sympathetic nervous system stays activated. And this causes more contraction in the prostate, more tension in the surrounding muscles, more inflammation. It's like driving a car always accelerated, always pressing the brake and the accelerator at the same time. The engine heats up, wears out, doesn't function properly. It's the same with your body. If you live stressed, worried, tense, the body reflects that, and so does the prostate. Now comes a detail that changes everything and that almost no one talks about: the pelvic floor. What is that? It is the region of muscles located at the bottom of the pelvis. These are the muscles that hold the bladder, the prostate, the intestine, everything there. And in most men, this area remains contracted without them realizing it. It's like a clenched fist all day long. You don't feel pain, you don't feel anything strange, but that constant tension is there, tightening everything, including the prostate. The result? More urinary urgency, more difficulty emptying the bladder, more trips to the bathroom at night. And there is a simple way to relax this in 2 minutes, which I will teach you shortly. But first, let me tell you about another factor that worsens everything: silent inflammation and mineral deficiency. The common diet of Brazilians, unfortunately, is low in magnesium. And magnesium is an essential mineral for muscle relaxation, for the proper functioning of the nervous system, to reduce inflammation. When you are deficient in magnesium, the body cannot relax properly. The muscles remain tense, sleep becomes poor, and the prostate suffers along with it. This is not a miracle, my dear. It's physiology. It's science. It's what the body needs to function well. Remember, this does not replace a medical consultation. If you have severe symptoms or blood in your urine, see a urologist immediately. Now that you understand what is happening in your body, the prostate squeezing the canal, the tense nervous system, the contracted muscles, the lack of important minerals, let me show you what we can really do to change this. But first, there is a mistake that most men make that worsens everything without you realizing it. The first mistake I see every day in my consultation is simple, but it makes a huge difference: drinking a lot of water in the late afternoon and at night. Look, I know you've heard that you need to drink plenty of water during the day, and that's true. Water is essential for health, but the time you drink makes all the difference. If you drink a big glass of water at 9 or 10 p.m. and go to bed at midnight, your bladder will fill up during the night. And with the prostate already sensitive and enlarged, you will wake up several times. The solution is quite simple. Your last large glass of water should be about 2 hours before going to bed. After that, just take small sips. If you feel thirsty, you don't need to have a dry mouth, but you also don't need to fill your bladder before sleeping. It's common sense, but many people don't do this and then suffer all night long. Now comes the second mistake, and this one is a champion: coffee, black tea, mate tea, soda. All of this after 5 p.m., my dear. Caffeine irritates the prostate, it speeds up the nervous system, it increases urine production. It's everything you don't want before sleeping. And I know, you're going to tell me, but doctor, it's just a little coffee in the afternoon. I've been drinking it for years. Well, maybe that's why you're waking up so many times at night. The correction here is also simple. After 5 p.m., switch coffee for warm water, for a calming tea like chamomile or lemon balm, or simply don't drink anything with caffeine. You'll see the difference in a few days. The nervous system will start to relax earlier, the prostate will be less irritated, and you'll be able to sleep better. But now comes the mistake that almost every man makes, especially in bed. And this is the most important to correct: contracting instead of relaxing. What do I mean by that? Many men, when they feel the urge to urinate during the night, strain to hold it in. They contract the pelvic floor muscles, tightening everything down there, thinking that this will make the urge go away. And sometimes it even works for a few minutes. But do you know what happens? You are tensing an area that is already tense even more. You are tightening the prostate even more. And when you finally get up to go to the bathroom, the stream comes out weak, interrupted, because everything is locked up. The immediate correction here is to learn to let go, not to tighten. When you feel the urge to urinate, instead of contracting, you will do the opposite. You will consciously relax that area. Relax the abdomen, relax the perineum, take a deep breath, and let everything relax. This already reduces urinary urgency because you are relieving the extra tension. And when you go to the bathroom, you will be able to empty the bladder much better. Now, full attention, because here comes the 2-minute trick before sleeping that I promised at the beginning. This is the trick that many of my patients use and report improvement already in the first nights. It's simple, costs nothing, and you can do it lying in your own bed. First step, prostate breathing. I call it that because it is a breathing technique that directly relaxes the prostate area and the pelvic floor. You will do this for 1 minute every day before sleeping. It works like this. Inhale through your nose, counting to 4, very slowly, filling your abdomen with air. Then exhale through your mouth, counting to 6 or 7, very slowly, as if you were blowing out a candle from a distance. And while you exhale, consciously relax the perineum area, which is the area between the scrotum and the anus. Relax as if you were releasing all the tension in that area. Do this for 1 minute, about 6 to 8 complete breaths. What does this do? It activates the parasympathetic nervous system, which is the system of relaxation and rest. Turn off that alert mode that keeps everything tense and physically relax the muscles that are tightening the prostate. It's simple, but it's powerful, and it costs absolutely nothing. The second step, which is optional but makes a big difference, is mineral support. Remember I mentioned magnesium? That's right. Taking magnesium glycinate or dimagnesium malate, 200 to 300 milligrams, about 30 to 60 minutes before sleeping, helps the body truly relax. Magnesium calms the nervous system, relaxes the muscles, and improves sleep quality. And when you sleep better, the prostate also functions better. Now, if you don't want to or can't buy a supplement, there's a simple and cheap alternative. Eat a small banana before bed or drink a glass of warm water with a tiny pinch of baking soda, if your stomach allows it. The banana contains magnesium and potassium. The baking soda helps to slightly alkalinize the body, which reduces inflammation. These are accessible, homemade alternatives that can help. But how to fit this into your routine without forgetting? The truth is that any change needs to become a habit to work. So I suggest you create a simple nighttime routine for your prostate. It doesn't have to be complicated. It can be like this. An hour before bed, you dim the lights in the house, turn off the television, or at least lower the volume. Put down your phone because the blue light from the screen also disrupts relaxation. Take your magnesium or eat your banana. And when you go to bed, do your prostate breathing for a minute while lying down, comfortably. All of this together prepares the body to truly sleep, to truly relax. And when the body relaxes, the prostate relaxes too. It's simple, but your body learns. With repetition, with consistency, the body understands that it's time to switch off, to let everything go, to rest. And when can you expect results? Well, I'll be honest with you. Some men feel improvement as early as the first night. They wake up fewer times, the stream flows better, and they sleep more deeply. Others take a few days, a week, to start noticing a difference. Every body is unique. But most of my patients who follow this routine report significant improvement in up to 7 days. And do you know what is most important about all this? You haven't lost control of your body, my dear. You are not at the mercy of your prostate. There are simple, inexpensive things you can do at home to improve your quality of life. You don't need expensive medication, and you don't need invasive procedures. Of course, in some cases, medication or even surgery may be necessary. And if that's your case, the urologist will guide you. But for most men with an enlarged prostate, these simple changes make a huge difference. Always remember, this does not replace a medical consultation. If you have severe symptoms, such as blood in your urine, intense pain, or if you cannot urinate at all, seek a urologist immediately. These are emergencies. But if your problem is waking up a lot at night, weak stream, or feeling of a full bladder, these tips will help you a lot. So tonight, before you sleep, I want you to try this. Do the prostate breathing for 1 minute, relax that area, and if you can, take magnesium or eat a banana. Start today, don't wait until tomorrow, because every night of poor sleep is a night you can't get back. And you deserve to sleep well. You deserve to wake up refreshed, with energy, ready to live your day. If this video helped you, leave a comment below saying, "I will try today," so I know you are committed to your health. And subscribe to the channel, because I will continue bringing practical, honest, science-based tips for you to take care of your health in a simple and accessible way. See you in the next video. Until then, take care of yourself, my dear.